Hello, everyone, and thanks for joining us for Access City Council. I'm your host, City of Las Vegas Communications Director David Riggleman. Coming up on this show, Mayor Pro Tem Brian Knudsen has been making the rounds in the Las Vegas Medical District. We'll get an update on all the new development taking place there. And in fact, Mayor Pro Tem Knudsen joins me right now. Welcome back to the program. How are you?
I'm great. Thanks for having me.
Hard to believe we're heading into October. The fall is right. It's here.
I'm so excited. Yeah. I love the fall time here.
That's right. Of course, the medical district we're going to talk about in Ward 1. You know the area very well, like the back of your hand. For those of you out there not exactly sure where Ward 1 is located, well, don't worry. We're just going to show you right here on the map. It's basically the area that's just west of the downtown, runs along the south side of US 95, but then turns up to the north. If you live in that area, work in that area, of course, you're in the city of Las Vegas. And if you're a resident out there, you are represented on the city council by Mayor Pro Tem Brian Knudsen. One of your main focuses has been the Las Vegas Medical District. You recently posted this on social media. You said, grateful to have had an inspiring brainstorming session about the future of the Las Vegas Medical District with stakeholders from the biomedical sector. And in fact, joining us now to talk more about that brainstorming session and the medical district is Tabitha Peterson. She's a senior economic development specialist in our economic and urban development department. Tabitha, thanks so much for being here on the program. I know you work it's good to have you here, and I know you work very closely with Mayor Pro Tem because this is one of your main focuses, main projects.
This is it. When I entered office, I got really good advice, and the advice is to pick one or two things that you just focus in on for your entire time in elected office. So in every show, I bring up the medical district. It's about improving healthcare. Every development that goes in, every apartment complex, every cone that's going in right now is about making a better environment for healthcare to happen. And I talked about it a lot. It's my son that was hospitalized. It's my daughter that was hospitalized. My brother was hospitalized. We can do a whole lot better in how we provide care to people. UMC is great, Valley is great, nurses, doctors great, but Southern Nevada deserves a lot better. And so that's what I've been singularly focused on, is the development of that medical district, and so much so that the city made it a third priority. So we have public safety, economic diversification, and healthcare. Yeah. It turns out that healthcare and economic diversification are one and the same, because doctors make a lot of money, and nurses and healthcare professionals, they do pretty well themselves. And so enter in Tabitha, because it was a major priority of mine, and I asked the city to make sure that we have some staff that can focus in on that, understand what it is. And Tabitha came to us from the Volunteers in Medicine of Southern Nevada with an extensive background in healthcare. And we've been partners on this for a while now.
Tabitha, tell us about this brainstorming session that we referred to at the top. What was the purpose and what was the outcome?
Yeah. So back in August, I presented to City Council about a report that we had done from a consultant and the results of that report. And one of the things was to focus more energy in figuring out what it could look like for us to develop more biohealth science spaces and support the biohealth science community in the medical district. And so we convened a group of experts in the community, researchers, people in administration, in already established businesses, some startups, to really talk to us about what it could look like. Where does this, and start thinking about where the city maybe has a role in developing out more biomedical research space.
Biomedical research, why is that so important? Because it's cutting edge, it brings new technology, new people. Why? I mean, obviously you're looking at potential cures too, but generally we think, well, those take place in other locations, but not Las Vegas.
Yeah, I think it creates an opportunity for research and innovation to happen, right? And when that happens in a space, you attract more healthcare providers to the area. So if I think about it from like an economic development lens, if we have really exciting research happening in the medical district, it's going to attract more doctors and physicians and researchers to the area, which of course they'll be involved in that research, but they'll also be available to support our community in providing better health care to our community.
You know, Mayor Pro Tem, I know that's one of the things that you've talked about a lot. In the past, I've been in Las Vegas many years, and to find that kind of synergy in the medical profession, often you had to go elsewhere, UCLA Medical Center, for example, or Mayo Clinic, or someplace else, Cleveland Clinic. But now with the medical district and the focus, the idea is to have that synergy take place right here in Las Vegas.
We just met with a group this morning, and there's been multiple groups just like this who have clinical trials going on in other parts of the country. And if you're really sick, if you have cancer, if you have, there's a former city manager that had some eye challenges, you kind of start Googling who's the best of the best. And you start trying to reach out and find out who can solve whatever issue that you have. Well, now those groups are coming to us saying, can we be part of your medical district? Because Las Vegas is a prime spot for people around the country to come into and have a great time, but we also want to be more than a great time. We want to be a place where you heal. And so that's just it. It's those people, those doctors, those nurses, those healthcare professionals, they're going to make more than $100,000 a year. They're going to contribute to the economy. They're going to change how we think about medicine here in Southern Nevada. And it's an ecosystem, and this is one piece of the overall development of the medical district.
Yeah. Talk more about that. How receptive has the medical community been to kind of taking this new leap forward for Las Vegas, especially people from out of town that aren't from Las Vegas?
Very. I mean, I think with the creation of the new medical school at UNLV, right, there's a new medical education building right in the heart of the medical district. Folks are really interested in what it could mean for us to be spending more time and energy building out that area and creating academic sort of medical district, right? That's focused on new ideas and growth and things like that. And so we've had, and everyone I've asked to help participate in these conversations has been really excited about doing it. I'm sure that we're gonna be dealing with moments where there's a little tension here and there. People are figuring out what their role is and where they fit in, but so far it's been met with a lot of interest and excitement.
It is exciting because I've lived here many, many years, and there were things that Las Vegas was never going to have. We were going to never have major league sports. Well, here we are. We got the Stanley Cup champs here, and an NFL team, and the Aces are the WNBA champs. We heard that downtown was never going to be anything but just being kind of the decaying core of the apple. Far from it now. It's thriving. And so people also said, well, we'll never see academic medicine. We'll never see Las Vegas become a hub for that kind of thing. We'll always have to go out of town to get the special care we need. And here we are. We're on the verge of changing that old myth as well.
That's what I love about living in Las Vegas. I love about this role in particular is Vegas can be anything you want it to be, and all it requires is a bit of persistence. And I say this to people all the time. Sometimes Vegas will shut a door in your face, and you just find a window, and there's always a path. There's always a path to do something in Las Vegas. That's why I love it.
Same here.
And so I can be passionate about healthcare, and you can hear the passion in Tabitha's voice. You can be passionate about it, and everyone can say it's not going to happen, and then 10 years from now, you look back and you don't remember not having it.
Oscar Goodman, when he was mayor, they thought he was Don Quixote chasing windmills, and look at it, what the impact we had with Smith Center, Ruvo Center, et cetera, all the things that were supposedly impossible that came to be. So, Tabitha, we're just about out of time. Is there anything else you'd like to add that the viewers would really like to learn, or that you'd like to make sure that they understand when it comes to what we're doing in the medical district?
Yeah, Mayor Pro Tem has mentioned this a little bit already, but I also want folks to remember that we're working on creating a more walkable, livable neighborhood too, right? So we want to see healthcare improve. We want to bring in, businesses that are going to have an impact on the health outcomes of our community. And we also want to create a neighborhood that is inviting and people don't want to run out of as soon as they're done with work, right? That can stay there, can live there, can eat there. Anything you would do and enjoy in your typical neighborhood. And so we're working on all those things in our department as well.
Real quickly, in your minds, each of you, where are we as far as the percentage of getting everything accomplished that we'd like to? Are we 50% of the way there, 25%? Could you put a percentage on that or try to quantify it?
I would never put a percentage, because the second that I have something that doesn't fit, I just expand the boundary.
Okay, there you go.
That's exactly what's going to happen.
I was going to say, I feel like it's limitless.
It's limitless.
I really do.
Good to hear.
The second you put a limit on it, people will walk away. There are no limits. We're open for business. Come on in.
Yeah.
Okay, well, very good. Well, Tabitha Peterson, thank you so much. Great having you on the program. Very interesting discussion. We're excited for the success that you'll bring to the medical district. And again, for someone who's lived in Las Vegas a long time, to see us moving into this phase in the medical field is really exciting, very much so. So again, thank you so much. And in the meantime, Mayor Pro Tem, you and I need to take a short break, but when we come back, we'll tell you about some great events that are coming to Ward 1, so please stay with us.
They say that when you're facing extreme danger, your life flashes before you. If you think that's sad, consider facing it before you even have enough life to flash before your eyes. Car crashes are a leading killer of children 1 to 13. Deaths and injuries can be prevented by using the right car seat. Visit safercar.gov/the-right-seat to know what is appropriate for each age and size.
Welcome back, everyone. We have a lot more to tell you about. Mayor Pro Tem Brian Knudsen is here, and you have been very, very busy. We're going to get into all that. Just got back from a trip to Washington, D.C., a very important one. In fact, you posted on social. I'm thrilled to join my fellow City of Las Vegas colleagues in the Las Vegas Chamber in Washington, D.C. for discussions with the White House and our Nevada congressional delegation about matters that are impacting Las Vegas and Ward 1. So tell us about this trip.
It was a very quick trip, and it was organized by the the Vegas Chamber of Commerce. The intent is to make sure that the federal delegation and federal agencies know that Las Vegas is on the map and deserves attention, and I think they accomplished that. For the Las Vegas side, I flew in on Sunday, came back on Tuesday. It was a very quick turnaround time. We met with White House, we met with the Department of Transportation, and every member of our delegation. The feedback we got was that we're the most organized city they've met with.
Oh wow, that's great
and
to hear.
it was very positive feedback, and it was trying to understand how we're leveraging federal dollars. What does that look like for our communities, and how we can partner with federal government on making sure they're reaching their goals. Lots of interest in the medical district and the Charleston corridor and the historic West Side that Councilman Queer spoke eloquently about. Councilwoman Alan Polinsky talked about first responder mental health, and we were able to talk about the crisis response system, which I can talk about.
Yeah, we're going to talk about that.
So we have a lot of synergies amongst us on the council, and I think that was very clear to the federal representatives and how they can partner with Las Vegas.
So basically the idea is to go there and tell the lawmakers, the decision makers firsthand, hey, these are our needs back in Las Vegas, back in Nevada.
And I think for the residents who are watching, understanding why a trip like that is important. Not everything that happens in Southern Nevada is your local tax dollars. Right. A lot of the funding is coming from the federal government. Right. And it's based on very creative, innovative staff here at the city that write grants, that create relationships with federal agencies, and then those agencies decide to give us money. And so this was a chance for us to showcase what we've done with those dollars and how we could leverage more.
That's terrific. Productive trip, you feel like?
Very productive, yeah.
Good.
I'm exhausted. It was a rough 3 days.
Well, I'm glad that you had a chance to get an audience and have our voices heard. That's great. Moving on, you also had posted this on X. You said, thank you, Ward 1 friends, for joining me at the fantastic Brews with Brian event today at Lou's Diner. Your presence and conversations truly make our community stronger. Lou's Diner is an institution over there. It really is.
It's really, for me, it's where the law enforcement meet. So that it's where I meet cops most often. But they do a great job there. Brian's the owner, and they do a great job. There's always little jams if you haven't been in a while. They have nice little like homemade jams that they give to every table. So Lou's Diner is the best for breakfast. And then it's my favorite way to interact with people is breaking bread, because then people complain for a few minutes, but then they start talking about what's real. And then you can figure out where the common ground is and try to solve the world's problems. And that's what you do over breaking bread, or if it's in the evening, you have a pint or whatever you do. That's the best time to talk to people.
In the mornings it's brews coffee, and in the evening brews.
Exactly, yes.
Bubbly kind.
It's sit down and focus in on the world around you. Let's try to have a good time while we're figuring out how we can be better people.
You do this once a month?
Once a month, yeah.
Once a month it takes place, and it's just very casual, not like you're coming down to City Hall.
I don't do formal very well, so I'm only know how to be casual, and this is one of the struggles that I have with the city is sometimes Christie, everyone knows Christie, they still try to make me talk at a podium, and it's just not my thing. As much as I want it to be my thing, as much as I try to be a more formal person, I'm just not. So if I can sit down and break bread and share a drink, that's the best place for me.
I think that makes the constituents feel a lot more comfortable too, just talking across the table versus having to come to a council meeting on the record and all the things that go with that. So, well, good deal. Brews with Brian, if you're interested in attending one, his newsletter, which people can subscribe to, we'll tell you about that at the very end of this program, how to do that with a QR code. You can find out about those Brews with Brian on his newsletter. Also, visit our website, lasvegasnevada.gov. Go to the Ward 1 page, and that information will be there as well. Speaking of public safety and getting out there, and you're talking about the police officers, you posted this on X. You said, yesterday I toured the Las Vegas Metropolitan Police Department's Communications and Dispatch Center, truly impressed by their dedication to keeping our city safe during emergencies. And boy, this is a really, really tough job because it goes 24/7. You got to be on your game, your A game, always, because things drop around the clock.
My favorite job of all time, even next to this one, was being a 911 dispatcher. Absolutely loved it. Super fun. It was a great job to have when I was in college. It went slow for periods of time. I could do homework, and then it got really, really busy. But learning how to manage emotions was a strong point of mine.
Listening to what people are saying, to what they need.
You can block out the noise and hear what the real emergency is, and I think that's a skill set that is lasted me a lifetime. It's very helpful to weed out all the noise and focus in on what the major issue is, and let's try to help you right where you're at.
So I've always wanted to know what's the magic hour. When does it get the busiest? Friday night between?
You can't predict it. That's why it's so much fun. You can't predict anything.
Really?
Yeah, people are unpredictable when it comes to emergencies. So there would be some ideas of what would be busy or what wouldn't be busy, and then you never know. For that particular tour, Metro's done an amazing job. They went through some really challenging years with a lack of staff. They have an academy right now, I think, with 80 people in it.
Wow.
And they expect them on the floor, taking calls, sending out dispatches in the next 10 weeks. And we are touring that center specifically for the rollout of 988. And we can spend more time talking about that, but that's our community's response to some of the more challenging issues that we have right now, is making sure that our dispatchers and our police officers and firefighters have another line of defense when it comes to people struggling with mental health issues.
Exactly right. That's something we're talking about a lot on this program, and just in the community in general right now, which is good to see. I think it's important to note, too, that if people are interested in knowing, when you call 911, your call goes to the Metro Dispatch Center. Now, if it's a fire call, then it's transferred to the city of Las Vegas. We're the call center for all the fire and rescue responses within the area. And so if it's a fire call, traffic accident, that type of call, it might get transferred over to us. So
for the city and the county. So when Metro 911 gets the call, not North Las Vegas or Henderson, they'll say, is this a police or a fire emergency? If it's fire or medical, they immediately transfer it. They'll stay on the line to make sure there's no public safety issues. But then our dispatch center will take it over for the city and the county.
So it's a very good and very efficient system. And Councilman, or Mayor Pro Tem, also speaking of health and safety of our community, you posted this on Facebook. You said, I have a newfound appreciation for our University Medical Center emergency staff. Today I shadowed Dr. Oberst, the attending physician for the emergency room. He filled me in on a day in the life, showing me firsthand why we need to transform our crisis response system in the city of Las Vegas. So what is that all about, Mayor Pro Tem?
And this is Dr. Aubert. That might be a typo on my behalf,
Sorry,
so
sorry.
I'll claim that for myself. So what it is it's really quite, everyone sees it, what's going on right now, especially in the downtown core of Las Vegas. If you're seeing that individual that's, is struggling with mental health or some drug addiction or alcohol issue, right now our system is calling 911. We're calling a police officer to respond. Police may exacerbate that situation. They may not be the right person for that situation. What we need to do is get those folks off the street into a place where they can recuperate. And this is going to be a 23-hour stay, let's say in a Barca Lounger, where they can sleep it off. They can get a shower, some clothes, connections to services, connections to food, shelter, whatever it may be. We need to keep those folks out of the jails, and we need to keep those folks out of the emergency rooms. And if you were to go into almost any emergency room around the valley, and this is true of every city around the country.
Right, I was going to say.
Those folks are flooding the emergency rooms. And that was what I saw when I visited with UMC with Dr. Aubert, is you had 90% of his job is dealing with people who have some level of a mental health issue. The medical emergencies are taking backseat to mental health emergencies. And we need to really think through as a society, as a nation, developing a new workforce that can handle some of these mental health challenges.
Yeah.
Where they came from, I don't know. I don't know if it was the fentanyl, the opioid addiction challenges that the country has struggled with. I don't know if it was COVID. I don't know what it was, but the world's changing pretty quickly. And as government, we need to adapt to that and reevaluate how we're providing services right now.
It's interesting you mentioned that, Councilman, Mayor Pro Tem, because this is a problem across the country. You hear story after story after story where communities are dealing with this exact same issue. Police trying to respond to really what are our mental health calls, jails being filled, hospitals being filled with people who really need probably a different level of care.
And the constituent, to the people who are watching right now, who I represent, they're frustrated, they're angry, they don't want to see people on the streets, they want people taken care of, but they don't know how to make it better. And so that's why I spend so much time talking about healthcare system. I also talk about mental health care system. We have to rethink how we're providing services at this point.
Well, speaking of first responders, you posted this on social. You said, as we continue to endure flash flooding, I'd like to take a moment to recognize the newly pinned graduates of the Las Vegas Fire and Rescue Academy who selflessly have dedicated their lives to protecting our community. Big class. We always like when they graduate because we got more folks getting out there on the floor that can help the community.
And that's a great career to go into. If you're thinking about being a firefighter or paramedic, now's the time to do it. If I were younger, I probably would. That would have been a career path, because that seems like a lot of fun to me. But for anybody who's thinking about it, we're always going to be in need of paramedics and firefighters in our community. So it's time to start training now.
And we've got a great fire department, Las Vegas Fire and Rescue, one of the top departments in the nation. So yeah, if you're interested, let us know, because we could certainly put you to work here. So. And then, Councilman, Mayor Pro Tem, want to let everybody know we have got a lot of events coming up. Really cool one. The Rainbow Company, been around many, many, many years. Theater company for kids, but there are some adults, shows that have adults and kids. The 2023-2024 season.
It's great.
Off, yeah.
It's great, yeah. And this upcoming, was playing right now, and will go for a few more days, is The Lord of the Flies. And so if you have an opportunity to go to the Charleston Heights Arts Center, it's right off of Charleston and Brush Street. It's a great show. The kids in that performance do a really great job. Highly, highly recommend it. I generally pick one show out of every show that they do, and I bring my kids, and we go up on stage and give all the kids certificates. Like, it's super fun. And they do, it's quality performance. They do
really
a great job.
The talent that comes out of there is really incredible. So if you've not taken in one of the shows, or if you've got a child, youngster who's maybe interested, I think I understand that one of the Knudsen kids is kind of...
Andrew's on Saturdays, he goes and he's learning how to do an audition. So he's learning how to expand on all those skills and abilities. And by the way, the cost of performance is relatively cheap. If you want to go to a Raiders game, that's going to be super expensive. You should go see a production of the Rainbow Youth Theater Company instead.
Exactly. Been around a long time. Again, Lord of the Flies, not Lord of the Rings, Lord of the Flies. We had to read that in school, Lord of the Rings too, but yeah, there it is. It's going to run beginning October 1st, but the interesting thing about this is that, again, to Councilman Mayor Pro Tem's point, the performances are really, really good. And this is the beginning of the season. They've got a bunch of shows that are going to be
Here's 8 or 9 shows coming up,
coming up afterwards.
One of the shows is the Addams Family.
Yeah.
So my son, who went to summer camp there, was desperately hoping to be the hand. So I don't know if he's going to be the hand this time, but he's very excited about seeing it.
Yeah, the thing. My son was in that show. In high school, he played Gomez, and then in college, he played young Lucas Binding.
Yeah.
So if you're interested in hearing all about that, give me a call. I'll fill you in. And then also, Councilman Mayor Pro Tem, we love when volunteers step up and help us. You've got a big park cleanup. You do these frequently, but this one is at Rotary Park on Friday, October 27th from 9 to 11, and that's over there on Hinson Street, not far from Charleston and Valley View, to kind of give you an idea of where that's located.
And these are great opportunities to come out and help the community clean up micro trash, but more so for me, it's about connecting with your neighbors. The world is too distant, too far apart, too focused in on social media, so get outside and just talk to people. It makes the world seem a lot more connected.
Right. And if everybody's saying, well, why are you doing it on a Friday? Because it's Nevada Day. So come on out. It's the last Friday of October. So that should be a day that students and others will be off. So you
Celebrate Nevada.
Celebrate Nevada by helping clean up Rotary Park. Done these in the past, generate just an amazing amount of trash and leaves and debris. And I've said this many times, we've got great grounds crews, but they can't get to everything.
Yeah.
We have 80 some parks. It's impossible to get to every single thing. So volunteers are greatly appreciated. So
come on out, get to know your neighbors.
Exactly. So October 27th, that'll be Nevada Day from 9 to 11. Love to have you come out. So Mayor Pro Tem, our time always goes fast. So we want to tell everybody out there, hey, we always want to hear from you. So if there's something you'd like to share with Mayor Pro Tem Brian Knudsen, you can find him on Facebook and X. You can also contact the councilman by picking up the phone, 702-229-6405, or send him an email. His address is bknudsen@lasvegasnevada.gov, and he or one of his great staff will get right back to you. You've got David, you've got April, you've got Maria, right, and yourself.
And me.
And you.
Like, don't forget, I'm part of it,
I know you're part of that, too. And that phone number that's your cell phone, so.
Yeah, but they all know it. I get texts and calls all the time.
And you always get back to everybody, so that's great, or just take that call. So, well, great to have you on the show. We'll see you in 6 weeks with another update from Ward 1. We'll be well into the fall by kind of knocking on the door of the holidays by the time we see you next time around, and looking forward to that. And folks, please don't miss our next show beginning on October 5th with Ward 3 City Councilwoman Olivia Diaz. You can now catch all of our KCLV shows on Apple TV, Roku, and Amazon Fire. Also, watch for our QR code during the closing credits of this show that I told you about to subscribe to our newsletter. And don't forget, you can watch us live on the internet at kclv.tv. Thanks for joining us, everyone. We'll see you next time around.